Well, Philippine authorities are set to implement a community quarantine of the entire region of Metro Manila this Sunday.
14-year-old Mark
of
Gutierrez
COVID-19
loves
in the
art,
country.
especially drawing happy faces. But the last few months were spent not inside a classroom, but in the fields of Pampanga province in the central community. Joey De Jos is checking whether his just so he can save $150 to buy a cell phone he needs for the newly implemented rule in one of the distance learning.
On January 30, 2020, the Philippine Department of Health reported the first case of COVID-19 in the country with a 38-year-old female Chinese national. On 7 March, the first local transmission of COVID-19 was confirmed, who is working closely with the Department of Health in responding to the COVID-19 outbreak. COVID-19 in the Philippines to start month-long community quarantine of Metro Manila.
Well, Philippine authorities are set to implement a community quarantine of the entire region of Metro Manila this Sunday, and that's to slow down the spread of COVID-19 in the country. Buena Bernal tells us more.
Bit by bit, we are starting to get a relatively clearer picture as to how exactly this community quarantine on the Philippines capital region, Metro Manila, will be implemented, considering that there are 16 cities inside the region. There has been widespread criticism on the way these restrictions on people's movements were announced Thursday night. They were announced much later than scheduled, and they were announced without clear mechanisms as to how exactly they will be enforced. But we have since heard from some Philippine government officials, including Philippines Cabinet Secretary Carlo Nograles, who said that there will still be a free flow of goods to and from Metro Manila.
Philippines faces worst COVID-19 in Southeast Asia.
Joey De Jos is checking whether his cash registers still work.
Yan, zero.
He owns Cafe 80s in one of the most popular districts in Manila. But the restaurant bar has been empty for almost 4 months because of the coronavirus pandemic.
It's like a ghost bar. No income. Before, this bar was packed. My staff has been here for 6 years. So it's very hard to tell them that we'll be shutting down if nothing happens until December.
It's a familiar scene all across the Philippines. Businesses are closing at a pace unseen in recent years. The Philippine government imposed one of the world's strongest, strictest lockdowns, which lasted from March till June. More than 50 million Filipinos were forced to stay at home in the entire region of Luzon. But the soaring number of coronavirus infections last month forced the government to announce another lockdown 2 weeks ago.
Philippines introduces stricter COVID-19 lockdown measure amid surge in cases.
I have heard the call of different groups from the medical community for a 2-week enhanced community quarantine, (SEQ) in Mega Manila. I fully understand why your health workers would like to ask for such a timeout period. They have been in the front lines for months and are exhausted. Nakikita at kausap ko ang iba sa inyo. Habaan ninyo lang. You stretch your patience and your not endurance, because you can only also take so much. Your fervor. Haan na lang ninyo yung pasensya ninyo and your fervor na ikaw isang medical tao. At tiwala kami sa inyong kakayahan.
Frontliners in the Philippines shared their struggle.
The biggest challenge namin is the fear of the virus because we didn't even know or even see the virus. So hindi namin alam those people na nakakahalubilo namin and all the patient kung sino doon ang positive or negative.
One of the biggest problem na na-encounter ko ngayon as a frontliner is safety of myself and safety of my family. Because yung battle na to is, it's hard for us to fight this battle because yung kalaban namin is hindi namin nakikita.
Mahirap din po yung acceptance ng mga tao. Yung stigma ng tao. Sa amin na mga frontliners na akala po nila, kami ay carrier of the virus or kami ang living virus. This is not just a profession but a vocation. So parang ito na po yung calling ko to be part of this pandemic and somehow change the stigma, change the attitude of other people towards us healthcare professionals.
Very rewarding on our part na meron kaming taong natutulungan, meron kaming taong na-extend yung buhay because we treated them and they are very thankful for us.
So kahit sa video call lang, nagkikita kami ng family namin. Sana maintindihan niyo ng tao. No, we always give grace to ourselves na hindi namin makita yung family namin. Just to overcome everything, to fight all these challenges.
Whenever may madi-discharge akong pasyente, sinasabi ko sa kanila, "Uy, buti ka pa makakauwi ka na, mamimit mo na yung family mo." Parang sa sarili ko, gusto kong sabihin, uy, siya makakauwi na, ako hindi pa ako nakakauwi. Parang ilang times na ganon.
Gusto ko din pong makita yung mga patients natin at gusto ko maging hands-on. Kaya kahit na risky and even if I'm faced with different risks and endangered my life, tinanggap ko na po sa sarili ko na ito talaga. Kung dito na po talaga ang peak ng career or ng buhay ko, so be it. God has purpose, God has reason.
It's our passion that keep us going. Na kailangan makatulong kami sa society. And ang motto namin is, walang iwanan. Fight for all.
Philippine schools struggle to educate poor children.
14-year-old Mark Gutierrez loves art, especially drawing happy faces. But the last few months were spent not inside a classroom, but in the fields of Pampanga province in the central Philippines. He's farming every day, just so he can save $150 to buy a cell phone he needs for the newly implemented rule of distance learning.
But we have no money. My mother has no work and my father is a welder.
The Aitas indigenous tribe is considered one of the earliest inhabitants in the Philippines. But for decades, their population has dwindled and now live in scattered mountainous parts of the Luzon region. Sapang-Uwak is a village of about 900 people. And just like most indigenous communities across the country, they have suffered dispossession and displacement for decades. But the coronavirus pandemic adds another layer of difficulty for the Aita families here. The Philippine government has implemented a distance learning program for all schools to help stop the spread of coronavirus. Education officials say it is unlikely that schools will reopen until a vaccine is available, which means Filipino children will have to study from home with electricity, a laptop, and internet connection. That's a major problem in a country where more than half of all families live below the poverty line and where millions have already lost their jobs because of the months-long quarantine lockdown. It's an even bigger dilemma for indigenous tribes like the Aitas, long suffering from discrimination and abject poverty. Many live without electricity or running water. To have a laptop and a working internet connection every day at home is almost unimaginable for them.
Hinihiling po sana namin.
You see, the indigenous people are far from the cities. We don't have coronavirus here. So why should distance learning be entirely implemented here too?
History books here tell us that the Aitas are the country's carrier of culture and identity. But for the parents here, they say all they care about is the legacy of education they want to leave behind for their children.